We've all been there, right? You're just walking down the sidewalk, enjoying the day, and bam, you trip and scrape your knee. Or maybe you brush your arm against a hot pan in the kitchen, or completely miss a step on the stairs and twist an ankle. In that split second of pain, panic usually sets in. But welcome to The Explainer. Today, we're going to take that sudden panic and turn it into a calm, highly structured decision-making process. We're using the Mederi Essential Guide to Minor Injury Care to build your ultimate triage playbook. So, the big question, you just got hurt. Now what? It's a highly relatable question, isn't it? Because in the heat of the moment, it is incredibly easy to just freeze up or make the wrong call. Should you put ice on that burn? Do you need to rush to the emergency room for a deep cut, or can you just handle it at the bathroom sink? Well, today, we are completely eliminating that guesswork. But before we get ahead of ourselves, let's actually define what we're dealing with here. A minor injury is defined as trauma that does not threaten your life or your permanent bodily function. So we're talking about your everyday cuts, scrapes, small burns, and sprains. Establishing this baseline right off the bat is absolutely crucial because it really dictates every single medical decision that follows. All right, let's dive right in. Here's our step-by-step triage decision tree for today. We'll start with the anatomy of a minor injury, then move into home first aid basics. After that, we'll cover exactly when to seek professional help, what to expect inside the urgent care clinic, and finally, the road to recovery. Section 1, Anatomy of a Minor Injury. Understanding the basics of minor trauma. So what actually falls under this umbrella? Well, clinics like Mederi Urgent Care treat these specific, very common minor injuries literally every single day. We're looking at deep cuts, abrasions, small first and second degree burns, sprains, contusions, which, by the way, is just the fancy medical term for bruises, and simple fractures. That just means the bone is broken but hasn't shifted out of place or actually pierced the skin. Moving on to Section 2, Home First Aid Basics, Immediate Interventions at Home. Okay, so when a cut happens, your kitchen or bathroom immediately becomes the triage center. First things first, apply direct pressure to stop the bleeding. Once it's stabilized, you'll want to wash the cut with cool running water just to flush out any dirt, apply a little antibiotic ointment like bacitracin, and then cover it securely with a sterile bandage. It's a super simple, logical flow to stabilize the wound right away. Now, the absolutely crucial point here is the 10-minute rule. You need to hold direct, uninterrupted pressure on a cut for 5 to 10 minutes. Honestly, don't even peek. If the bleeding still won't stop after that 10-minute mark, well, your at-home care phase is officially over. You need to go get professional care. Now for burns, the protocol changes a bit. You want to run cool, not cold, but cool water over it for 10 to 20 minutes. Then, apply a burn gel or antibiotic ointment and cover it really gently with some sterile gauze. And please listen to me on this one. Absolutely no ice, no butter, and no grease on a burn. I know you've probably heard those old wives' tales, but they actually trap heat and cause way more tissue damage. What about sprains and strains? The RICE acronym is a highly effective, super easy to remember mental flowchart. R is for rest. I is for ice, specifically 20 minutes on, 20 minutes off. C stands for compress, using a snug but not overly tight elastic bandage. And E is for elevate. You want to prop the injured area up above your heart level to really help minimize that swelling. Just like that 10-minute rule we had for cuts, sprains have their own critical threshold, 48. You should ice a sprain and follow that RICE method diligently for the first 48 hours. If the pain or the swelling just doesn't improve by then, or if you physically cannot bear weight on the joint at all, it's definitely time to escalate things to a medical professional. Which brings us to Section 3, when to seek professional help. Recognizing when home care just isn't enough. You know, you really don't have to guess when a cut needs professional closure. There are actually exact physical thresholds for this. You likely need stitches if the cut is deeper than 1/8 of an inch, longer than 1/4 of an inch, or if the edges are visibly gaping open. Also, if it's on a highly sensitive or mobile area, like your face, your hands, or right over a joint, or if it was caused by a visibly dirty object. And remember, timing is everything here. Cuts generally need to be stitched up within a crucial 6 to 8 hour window. And what about bones? Well, here are the specific warning signs telling you that you might have a broken bone that requires an X-ray. Look out for severe pain when you try to move it, a visible deformity in the limb, or immediate significant swelling. Also watch out for a total loss of function, any numbness or tingling, or, and this is a big red flag, if you actually felt or heard a pop or a snap during the injury. A quick 15 to 30 minute X-ray evaluation will give you a definitive answer. Look, knowing where to go is half the battle. Urgent care is absolutely perfect for deep cuts, simple fractures, and small burns. But the emergency room, that is strictly for major traumas. We're talking severe bleeding that just won't stop, head or spinal injuries, loss of consciousness, or an open broken bone where the bone has actually broken the skin. Separating minor injuries suited for places like Mederi from major traumas keeps those ER wait times down and gets you the right care way faster. Let's head into Section 4, inside the urgent care clinic, what to expect at Mederi. So walking into Mederi Urgent Care without an appointment actually follows a really efficient flow. After you check in, a professional does a physical assessment, followed by a diagnosis. That might include those quick x-rays we just talked about. From there, you'll get your actual treatment, whether that's wound care, stitches, or putting on a splint. And finally, they'll give you clear aftercare instructions so you know exactly what to do when you get back home. To make that visit completely seamless, grab a few practical items to bring with you. A photo ID, your insurance card, a list of any current medications you're taking, and your primary care doctor's name. And hey, it's worth mentioning, if you don't happen to have insurance, do not panic. Clinics typically have really transparent self-pay options available, so you can absolutely still get the care you need. Finally, Section 5, the road to recovery, healing timelines and aftercare tips. So our bodies heal at totally different rates depending on the tissue involved. For minor cuts and scrapes, you're looking at just 3 to 7 days. Small burns take a little bit longer, usually around 1 to 2 weeks. Sprains and strains typically heal up in 1 to 3 weeks. But for simple fractures, you really have to be patient there. That is a 4 to 12-week process for the bone to fully knit back together. To really support those healing timelines, you can manage any discomfort with over-the-counter pain relievers like ibuprofen or acetaminophen. Definitely keep your wounds meticulously clean and make sure you're changing your bandages every single day. But listen, I want to emphasize this absolutely critical point. Watch closely for infection. If you start seeing increasing redness, unusual warmth, pus, or red streaks traveling outward from the wound, call a doctor immediately. And lastly, just listen to your body. Don't rush right back into heavy physical activity. Now, if your injury actually required stitches, remember this magic number, 7. It generally takes between 7 to 14 days to have those stitches removed. There is a slight exception, though. If the stitches are on a highly visible area, like your face, they can usually come out a bit sooner, often in about 5 to 7 days, just to help minimize any scarring. As our source material notes, getting the right care quickly reduces pain, prevents infection, and helps you recover faster. And honestly, that perfectly summarizes the entire philosophy of our explainer today. Timely, structured care isn't just about fixing the immediate pain. It is literally the fundamental key to ensuring a smooth, complication-free recovery. I want to leave you with this somewhat provocative thought. Is your home first aid kit actually ready for these moments, right now? Seriously, if you tripped and scraped your knee today, do you have the sterile gauze, the antibiotic ointment, and the elastic bandages ready to go? Take 5 minutes today to just check your supplies, because the best time to triage a minor injury is before it ever happens. Thanks so much for joining me on this explainer. Stay safe out there, and I'll catch you on the next one.